Physostigmine. It is a naturally occurring alkaloid derived from the calabar bean. The clinical case. A 22-year-old college student is rushed to the emergency department. He is agitated, confused, hallucinating, and picking at imaginary objects in the air. His skin is hot and dry, his pupils are widely dilated, and his heart rate is 150 per minute. His friends reveal that he accidentally ingested several tablets of an atropine-like medication. Within minutes of receiving a single drug, his delirium disappears and he becomes fully oriented. How can one medicine reverse both the central and peripheral effects of anticholinergic poisoning? The answer is physostigmine. Why physostigmine works everywhere? Physostigmine is a tertiary amine carbamate. This structure allows it to cross the blood-brain barrier, producing effects on both the peripheral and central nervous systems. Also known as Eserine, it is the only anticholinesterase capable of reversing CNS anticholinergic toxicity. Mechanism of action. Physostigmine enters the synapse and binds to acetylcholinesterase at the active site. Acetylcholinesterase is temporarily carbamylated. The enzyme is inhibited, but the effect is reversible. Acetylcholine is no longer broken down and builds up at synaptic junctions. Excess acetylcholine stimulates both muscarinic and nicotinic receptors throughout the nervous system. Normal cholinergic tone is re-established in both the CNS and peripheral nervous system, reversing anticholinergic toxicity. Side effects. Since physostigmine increases acetylcholine at both muscarinic and nicotinic receptors and also crosses the blood-brain barrier, its adverse effects can be divided into three groups. Let's begin with the muscarinic effects. Excess stimulation of muscarinic receptors produces bradycardia, increased salivation, bronchospasm, diarrhea, and sweating. Next are the nicotinic effects at the neuromuscular junction. Mild excess stimulation causes muscle twitching, while high doses produce persistent receptor activation, eventually leading to weakness due to a depolarizing block. The most important feature that distinguishes physostigmine from neostigmine is its CNS toxicity. Because physostigmine crosses the blood-brain barrier, excessive doses can produce confusion and, in severe cases, seizures or convulsions. Therefore, careful dosing and close monitoring are essential, especially when physostigmine is used to treat anticholinergic poisoning. Clinical uses. The most important indication is as an anticholinergic antidote. Physostigmine is the primary treatment for severe anticholinergic syndrome, especially when patients develop delirium, agitation, and hallucinations after poisoning with drugs such as atropine, scopolamine, or diphenhydramine. Because physostigmine crosses the blood-brain barrier, it reverses both the central and peripheral manifestations of anticholinergic toxicity. The second use is in glaucoma. When applied topically, physostigmine produces miosis, or constriction of the pupil. This opens the drainage angle, improves aqueous humor outflow, and reduces intraocular pressure. Although newer drugs are now preferred, this remains a classic pharmacological application. Finally, physostigmine has been used for post-operative arousal. Historically, it was administered to reverse emergence delirium or excessive sedation following anesthesia or benzodiazepine use. However, because safer alternatives are now available, this indication has become much less common. Let's conclude with the key takeaways for physostigmine. First, remember its source and structure. Physostigmine is a tertiary amine carbamate obtained from the calabar bean. Unlike neostigmine, its tertiary amine structure allows it to cross the blood-brain barrier, so it produces both central and peripheral effects. Second, understand its mechanism. Physostigmine is a reversible acetylcholinesterase inhibitor that increases acetylcholine levels, enhancing cholinergic transmission at both muscarinic and nicotinic receptors. Third, remember its primary use. Physostigmine is the antidote of choice for anticholinergic toxicity because it is the only agent that reverses both CNS and peripheral effects. This makes it especially useful in severe atropine-like poisoning associated with delirium and hallucinations. Finally, always watch for its important adverse effects. Because it enters the CNS, excessive doses may produce confusion, seizures, and convulsions, particularly at higher doses.